Hey guys, Don here. Welcome to the $1 Million Minute from Podiatry Practice Mastery, helping you get your practice to the $1 million mark and beyond. I'm going to go over it's a Wednesday that I'm kind of going through the patients. This is kind of a short week due to February vacation, so I'm a little more sporadic, enjoying times with the kids, and my mom's here visiting and things like that. So, but this is for the last time I was in the clinic. I'm going to go over this. 23 patients, 20 minutes opening, so it's a better day. It's been a little bit slower this time of the year because it's mid-February when I'm recording this. First patient was a Lamisil follow-up, so they came back for a nail sample, so that would be level 4 visit because of medication management, and then they got the Lamisil booster. This was the second round of the Lamisil. Second patient here was a 63-year-old man. He's status post revascularization from one of my vascular colleagues here, and he had an ulcer to the tip of the toe that wasn't healing, and they did a revascularization, so he's doing much better. I'm going to just see him back for regular routine care. Next patient was my MVP. This is a 46-year-old man. He is a historic marathoner, not ultra marathoner, but triathlete, and kind of very intense, and he had a procedure with a spur resection to the posterior heel. Didn't really go that well and never really got rid of his Achilles tendinitis. There's still swelling around the insertion of the Achilles. Quite frustrated, didn't know what to do. He came in. I've seen a couple of these recently. I always say it's easier to be the second opinion than it is the first opinion. But what he is getting today, EPAT number 1 out of 6 with focused and radial. He also got an Amnio. And when I let patients I let them decide when they want to do it. I usually say whenever the best time is that you can wear a walking boot for about a week. So I put an ultrasound guided Amnio in there. I did an ultrasound of his Achilles as well, and I put him in a cam boot. So that was the MVP, most valuable patient of the day. Next was a 41-year-old patient. This is a patient, he is status post 11. Count that, 11 shockwaves. So he is a nurse, he's a basketball player, he's a big guy, like his feet are like size 13. And he has been doing great with the shockwave for his plantar fasciitis. The only challenge is when he's running. He has some difficulty. So my recommendation for him was to do an orthotic. So this is orthotic number 1 for the day. High contouring orthotic to offload the fascia and offload the strain going through the fascia. Next patient was an 87-year-old patient. This is a colleague. He's another primary care doctor, and it's his mother. So I'm kind of dealing with an ulcer that she has to the tip of her toe, and I did also recommend her seeing a vascular doctor to maybe get some more blood flow, because I think it's more of a vascular issue. Next patient was a 58-year-old female. She has pain to the first MPJ, kind of a hallux limitus type of a thing, and we're doing that was shockwave number 1 for her on that. Shockwave, once again, does not bring back cartilage, but it can help with bone marrow edema around the joint if you can get up to the therapeutic dose, because sometimes it can be too painful. Next patient was a 67-year-old gentleman. He had EPAT status post. Actually, he got set up for 3 sessions of EPAT for his posterior tibial tendon, and he got orthotics. So this was an orthotic patient. He's doing well with his orthotics, and we're going to set him up for the 6 sessions of the shockwave for his posterior tibial tendon. This gentleman wants to do a really long hike. It's real important to him, and he doesn't want to be sidelined because of this. So his orthotics were picked up today, so I'm going to do a 6-week follow-up for the orthotics, which is what I normally do. So I dispense them to him. And then I also am going to set up 3 sessions of shockwave. The reason I didn't do the first one today is because he had taken some Motrin recently. Next patient, this was a 58-year-old female. She's here for status post plantar fascial injection. I don't do a lot of those, but I did this for her. She's feeling much better, but I talked to her about keeping the pain away. So I think cortisone can reduce the inflammation, but it doesn't really fix the mechanics of the foot, and so she was scanned for orthotics. That was orthotic number 2 for the day. Next patient, a 26-year-old female for a partial nail avulsion due to an ingrown toenail. So you might call it an IND, but there's no infection, so that's why I just take out the edge, trim out the callus that's stuck in the edge there. No follow-up for her. Next one's a 55-year-old. This is a female. She's status post 6 sessions of shockwave due to overloading the forefoot region of her foot. And she had failed orthotics in the past, but I really recommended that to offload that area due to her high arched foot type, so she got an orthotic. So this is orthotic number 3 for the day. And I'm going to see her back when she picks up the orthotics. She's doing better after these 6 sessions of shockwaves. She had 6 sessions, and then she also had an amnio injection to the kind of the second MPJ region. Okay. Next patient was a 58-year-old female. She's follow-up with third intermetatarsal pain, like neuroma pain bilaterally, but it's kind of out of proportion. So I recommended she see a rheumatologist because it's kind of diffuse to the met heads, and it's painful, and there's not much swelling. So I really wasn't sure what was going on for this patient. So I recommended her seeing a rheumatologist. Next patient was a 53-year-old female that came in for shockwave for the Achilles tendon. Next was a 61-year-old patient that had a porokeratoma, and I did lesion destruction on that. Next was an 80-year-old female with some heel pain. She was here for heel pain follow-up. She tried some of the initial treatments, foam rolling, night splint, meloxicam, and she also acupuncture, and she didn't really want to do anything else. Didn't want to do ultrasound, didn't want to do any of these other things. So I'm not going to see her back. I'll see her back if she needs me. Next was a 62-year-old female for Achilles, EPAT number 2. Next was a 72-year-old Lamisil number 1 visit, so I saw him back for the nail sample, and I did his Lamisil and his UV light and things like that. Next was a 67-year-old. This is a gentleman also. He had here's for follow-up status post 6 shockwaves to the forefoot region. In him as well, I find that part of it was overloading, and so I did scan him for orthotics. So this is orthotic number 4. What I find is if people are willing to invest in like 3 to 6 shockwaves, then a lot of times they're willing to invest in orthotics. And so just kind of being confident about that and wanting them to offload that area. I think the shockwave can help repair, but it doesn't do a great job at offloading if there's other mechanical issues with it. So that's kind of my conversation these days, is the difference between the symptoms and the mechanics. And I can treat the mechanics more with like shockwave and like physical therapy, night splint, and then the orthotics. And then I can treat the symptoms with other things. Next patient was a routine patient, 101-year-old patient. I always give these ones a hug. She had and a kiss. 101-year-old. She had some gouty tophi in her toe. They were concerned. It wasn't opened, it wasn't ulcerated, but she has this kind of white, chalky, gouty tophi there. I'm going to see her back as needed. Next was a 76-year-old patient for a nail sample follow-up for her, and she also had a paronychia. Next was a 63-year-old patient for an ingrown, so I did an IND. And the last patient of the day was a 66-year-old patient. This is, she did follow-up status post 6 shockwaves to the Achilles insertion, and she is 100% better. She's a super raving fan, happy, because she's been dealing with that so long. So that was the work for the day. Once again, if you like this, please let me know. Share it with other people, and give me a comment. Shoot me an email down at podiatrypracticemastery.com how I can help you more with this content.